This year we celebrate 75 years of the NHS, the greatest achievement of this country, the greatest achievement of the Labour Party, delivering a universal healthcare system based on need, not profit, and we know the fight for this system is now existential. 13 years of austerity and the systematic defunding of public services has left our communities facing abject poverty and inequalities, conditions not dissimilar to those of the 1940s when the NHS was first introduced. Health inequalities are rampant and growing. Children living in poverty are now diagnosed with Victorian diseases. Life expectancy is falling to the first time in recent memory. Children's height is now reducing year on year. Chronic ill health, both physical and mental, is increasing. Systematic underfunding, private sector plundering, decades of privatisation via the back door and fragmentation of diagnostics and treatment services have brought the NHS to its knees. Before the NHS existed, there was a complex, fragmented and chaotic patchwork of services which led to poor and inconsistent practices motivated by profit rather than best practice. This is the direction that many on the opposite benches are now pushing, with demands for a public-private partnership and models of insurance-based funding of the privatisation of sections of health service being touted under the guise of reform. It didn't work then and it won't work now. The evidence is clear. Health services are better quality, more equitable and more cost-effective when nationally planned and provided by democratically accountable public bodies with expertise. Good friend has talked about the benefits of the private sector, but I just wanted to point it out. Carillion, who were building NHS hospital in Liverpool, went bust, which impacted significantly in terms of delivery of services to the constituencies in Liverpool Riverside. So to that end, we must repeal the Health and Care Act and reverse and eliminate the US-style integrated care systems which enable corporate influence over policy and profiteering at the expense of patient care and workers' pay. We must tackle health inequalities head-on and push back attempts to establish a two-tier health system which would only entrench these inequalities yet further. We must completely abolish the private sector in the delivery of the NHS services and instead restore much-needed funding with a serious programme to recruit and retain the staff needed to end the exodus of NHS staff. Only with this bold action to restore the fundamental model of the NHS, universal provision, free at the point of need, can we once again make the NHS a world-leading institution.